Patients deserve the very best in healing design. Anshen and Allen has designed an ideal environment that combines the best strategies for patient care, sustainable design, and accommodation for families. A harm-free environment, passive survivability, and green materials are at the core of this innovative room. Please join us in this exploration.
This was our ideal patient room for concept suite. This has a sitting room actually adjacent to it, which could be converted to other uses in the future. This was totally developed and rendered in sustainable materials and created these places in the room. The systematic sort of idea is the harm-free room. That there's nothing in this room from a materials and environment or a safety standpoint that causes harm to the patient. And I think if we think of this systematic approach to this conceptually, that's really where all of these things are woven together.
To be able to actually quantify the potential increase in the satisfaction of both the patient and the staff with their interior environment. What's actually even more important from a healthcare perspective, both from the patient and the staff, is the quality of the interior environment that you're creating. But one of the things that we've been trying to do is figure out other ways of quantifying that increased quality of the interior environment and the potential impact on both the patient and the staff.
There's one concept I want to toss out that is also related to sustainability a little bit more directly, which is one of passive survivability. These are buildings, in most cases, that are going to be called into even heavier use during a time of a natural disaster. So I think it's really important for us to think of the patient room and more holistically the building, but in this case, the patient room as something that can survive at an optimal level without electricity, without natural gas, without all of the services. What does that mean for how the room is used? What does that mean for the people in the room, for the way the room works, for the materials, etc.?
The difference is that we do have windows from the corridor. We have decentralized nursing, so between actually at this point each room we have a nurse station. It was double before when we could do back-to-back bathrooms. Now the bathrooms are not back-to-back, so basically the same module repeated across the building. What's good about this is you have a very direct access route from the patient bed.
When we look at green materials, I think they're here to stay, and I think that there's enough manufacturers out there that really take it to heart. In the restrooms, we were looking at this type of kind of like a mosaic, multicolored porcelain tile for one wall.
In terms of sustainability that we have on this project, we use the Stratica product, which is made out of something, it's something called Sherlin, which they actually coat golf balls with. So it's very, very hard, it's very durable. We have a terrazzo type looking product here that has recycled glass content in it. We have actually two types of stone look of this product. There are 5 zones that define this model green patient room: the family zone, the patient zone, the staff zone, the terrace and connection to nature, and the bathroom building systems zone. Each zone includes a new idea that is at the forefront of healthcare design.